Well, good morning, and thank you very much for the opportunity to participate. I'm one of those folks that was described yesterday as maybe only knowing one or two people in the room when I arrived. So I've really learned tremendously by listening to the conversation. And also thank you for recognizing that there really is an opportunity to bring patients, researchers, and health systems together to better understand how we can solve some of our nation's healthcare problems. Just a few words about Christiana Care Health System because I'm going to guess that many of you have not heard of us before. We are a large regional community-based academic health center. We have 3 campuses, 2 acute care hospitals, over 1,100 beds, a rehab hospital, a VNA, multiple outpatient sites, and we are approaching $2 billion in revenue. We serve Delaware, the entire state of Delaware, South Jersey, southeastern Pennsylvania, as well as Cecil County, Maryland. But we're the dominant provider in Newcastle County. We have about 85% market share. And I share that because it's important to this conversation because our CEO often describes us as a public utility. So our community depends on us, and we have to be there. We have to be sustainable. So when we think about education, when we think about research, we think about them as critical enablers of our ability to serve our community. So we recently refined our mission, and we talk about the Christiana Care Way, which says we serve our neighbors as respectful, expert, caring partners in their health. We do this by creating innovative, effective, affordable systems of care that our neighbors value. And again, I'll emphasize our neighbors' value because as we heard this morning, for us, value is not how we define value, but it's how the people we serve really define value. So about 3 years ago, we actually created and funded an entity called the Value Institute. And the express purpose of this entity was to bring together quality improvement, bring together operational excellence, which is our lean world, and marry it with healthcare delivery research. We created this group to actually do what we've been talking about today. And the perspective of our CEO is that the Value Institute is a way for us to focus on value as our fundamental strategy for service. So again, it's more than quality and cost, but it's really very much about that value, which is grounded in the needs of our neighbors as they perceive them. So the Value Institute aims to study and design solutions to questions of care in the real-world setting of healthcare delivery. So for some of the work that's currently ongoing, we are studying highly reliable trigger tools in the setting of over-sedation, which is a top priority for healthcare systems, as well as looking at trigger tools in early sepsis. We're looking at refining anticoagulation algorithms for patients who are undergoing surgery. And we are the recipient of a $10 million CMMI innovation grant and really looking at how we can use new technology to bring data together, organize that data, and present it to clinicians and care coordinators who can actually act on it and improve the care of patients with ischemic heart disease. In addition, Christiana Care is a founding member and partner of the Delaware Health Science Alliance. Again, another opportunity to bring organizations together. So the Delaware Health Science Alliance is Jefferson University and the University of Delaware, the more traditional academic engines, and Christiana Care Health System and Nemours Children's Hospital, the big clinical entities in the state. And again, this was done very specifically so that we could develop a vehicle for research and specifically to focus on how do we improve our health services and how can we impact the health of our community. And the Delaware partners just received a $25 million CTR grant to enable some of that work. So for the closer alignment of practice and research, what's the core appeal for a CEO? Well, I think it's really embodied in what we're doing in our Value Institute. And I think the conversation yesterday and then again today, particularly as expressed by Brent James and Mary Brainerd, sort of really get to that for a health system. Because again, our first and foremost commitment is in caring for our neighbors. And if we can align so that there's potential for us to do better in delivering our core mission, then we're going to invest in that work. I'm actually going to start with patients and families because from my perspective, engaging patients and families is a must-do. So if there was a singular message to take to the CEOs, it would be, how does your organization define patient-centered? It's actually not a new concept. In the 1960s, the pediatric community developed the patient-centered medical home. The Institute of Patient-Family-Centered Care started in the mid-1980s. So the term has been around for a long while, but what does it really mean? And I think if you don't have a structure that deliberately and purposefully includes patients and families in designing care in a meaningful way, we're just not going to get it right. So I think the CEOs need to embrace Mary's message and really look at partnership with patients and families as a core business strategy. And they can start to provide an infrastructure that not only gives patients a seat at the table, but a voice at the table. So to me, that's really job one.
What does that structure look like, Janice?
Well, I think, it starts with patient and family advisory councils, but it goes beyond that. So certainly what we're in the process of doing is embedding patients and patient advisors in every patient care unit. We have them in our big system committees, but it's really about getting into some of the details. And I think certainly at our smaller hospital, in our intensive care unit, we've had the greatest expression of that. There are 2 patient advisors. They participate in all of the different meetings. When we recently transitioned the old unit to a new building, they were there at 5 o'clock in the morning working with patients and families, making sure that was a successful transition. It's invaluable because and whenever I've sat in our patient family advisory council, I usually have a notion about what an answer to a question is going to be, and I constantly learn. I'm constantly surprised. They have to be at the table.
If you could just wrap up with a couple of key bullets.
Yeah, just a couple of things. I think we do need help in aligning priorities. There's that tension we talked about, organizational priorities and those of the individual researchers. I think we need payers as partners because we do need to figure out how we get paid for this. And in terms of outcomes, I think it is the triple aim, but part of that is a commitment to transparency. We need to make sure that our patients and families can understand outcomes in a way that enables them to make good decisions for their health.
Terrific. Thank you very much, Janice. And now, Russ, over to you.